In the suburb of Hamilton in Leicester, local volunteers are setting out on a job in the national interest. They're knocking on doors to tell residents where they can get COVID tests.
We're just in the area telling everybody about the new rapid testing centres that have opened.
The virus is clinging on here, where much of the rest of the country has seen cases decline rapidly. It's a different picture in this city.
There is a lot of ignorance amongst people in understanding the seriousness of this situation,
Leicester has really suffered throughout this pandemic. Even today, in some areas like this one, cases are 4 times what they are nationally. And the problem Leicester has is that in some areas the vaccine take-up is 40% lower than it is across the rest of the country.
The risk then that cases could start to increase again is very real. It's why health officials are focusing so heavily on contact tracing and testing in certain communities.
Things haven't changed. Something isn't working here.
So whilst we have been in sort of the top areas, there are times when other areas have spiked out that we've been towards the bottom. So it'd be great if it was as simple as saying there is something that is not working here. It is something that is about our communities and about some of the inner city communities that make it a very, very challenging disease for us.
Vaccine take-up is frighteningly low, though, in some deprived areas at just 50%. GPs are taking it upon themselves to call those reluctant to have it.
When we contact people, we find that after a relatively brief conversation, up to 70% are more than happy to have the vaccine. Very few, less than 10%, still refuse, and the other group want to have a bit more time to think about it.
Leicester's schools go back in just 3 days, but even nationally, there's no room for complacency.
It's really important, while we wait for the vaccine programme to reach all adults, that we're very wary of the fact that we have to follow the rules of lockdown and of social distancing, because what we don't want is for the virus to go up again.
In time, these streets will be alive again with residents. Cases haven't yet gone back up, but as long as the virus lingers, that fear will always remain. Emily Morgan, News at 10 in Leicester.